Welcome to the new three-part series on climate and health organizing. We're so excited to collaborate on this series with People Power Health, a group of community organizers and trainers focused on empowering clinicians with activism skills to respond to health injustices and co-create equitable health systems. I'll host this first episode, and then I'll pass the mic to my friend, Pedja Stojicic, a global senior consultant at People Power Health. We hope you'll come away with a new understanding of organizing and actionable skills you can implement in your communities. Clinicians are trained to diagnose and treat, whereas community organizers are trained to mobilize and strategize. At first glance, those roles might seem worlds apart. But as the climate crisis increasingly threatens the health of our patients and communities, more and more health professionals are adding the roles of educator and policy advocate to their clinical identity. Organizing gives health professionals a way to expand their impact beyond the exam room. It's about learning how to bring people together, build power, and tackle the upstream drivers for poor health. Our guests today are doctors Pedja Stojicic and Gaurab Basu. They are showing what's possible in climate and health organizing, while helping others grow through training, mentorship, and network building. Our conversation will take listeners on a journey from recent organizing efforts, along with best practices and challenges, to a discussion of where clinician activism might go next. Pedja and Gaurab, we're so excited to have you here with us today. So we have worked together off and on over these years, and I've been a big admirer of y'all's work because the special place that you inhabit, and I think the really important one, is to really help clinicians use their voice outside the clinic walls and the hospital walls. And a lot of the work is around organizing. So clinician and organizer, these two words, people don't often think about them together. But could you tell us, for each of you, how do you see this going together? Why have you made this your job, your profession in terms of what you do?
I'm a physician by training and has been in this space of limbo between the two callings, what I would say. One is the calling for healing, and the other is for calling to actually organize communities and work with other people in a collective effort to change the circumstances that we have. And what is really interesting is that when we do this work, we are not inviting people to change their profession. We're really inviting them to add to their toolkit of healing a skill of organizing other people and doing it collectively instead of doing it individually. Yeah. But Gaurab, curious to hear your thoughts as well.
Yeah, I mean, Lisa, I think I start from a place of really believing that human beings are really remarkable, that we're living on a remarkable, magnificent planet, and we're capable of really taking care of each other. I'm a primary care doctor, adult medicine, and we see that in our clinics of like what people can do for one another in their own lives, what we as clinicians can do to offer care and healing. And that's really the heart of, I think, our practice, is to be there for people. And early in my career, I just realized that these broader impacts, public health impacts, have profound impacts on health equity and our ability to thrive and have health. And so I have been really heartened to see the ways in which people want to organize, to speak up, to talk about the policies that will enable our communities to be healthy. Organizing starts, from a deep belief in connections with one another, in community, in storytelling, and then building strategy of how you can get policy wins that you believe will help your patients. And so I would say that spirit of what brings us to clinical medicine really gets activated in the practice of community organizing.
Y'all have provided a really great framework in thinking about how clinician and organizer fit together. Can you tell us a little bit about your personal journey into this work?
I'm originally from Yugoslavia, the country that doesn't exist anymore. And my introduction to this is twofolded. Like, one was, deeply personal. When I was a little kid, at the age of 7, I saw my dad having a heart attack. And I was, really struck by the fact that despite the fact that we were a really big family, my father had 6 siblings, there was no doctors and nurses in our family. And for little Pedja, that was a connection, like to become a doctor or a nurse or a health professional means to actually save your dad, like really practically kind of speaking. So that was the driver for healing. But the other driver that was happening at the same time was what was happening in Yugoslavia, the civil war, a dictator running my home country, Serbia, at the time, and how we, as young people, didn't have exit. So the only way for us to deal with that was actually to do something about it. And from that sense of kind of like disconnect and not ability to run away from the problem, we had to face each other and do some work together. And I started my activism and advocacy work in HIV/AIDS, actually, which was kind of like a issue relevant to young people. And surely, really fast enough, we learned that there's so much when you build a relationship with each other, when, as Gaurab was pointing out, where you are in close relationship with each other, that turns into power. And that power becomes a force more powerful than any other country in the world. And witnessing that at the age of 20 got me really hooked up to the idea that, people have the power. And the question is, can we build strong enough connections and relationships with each other for that power to materialize in the real world? I witnessed that in my home country and trying these days to really enable other people to do it as much as I can. The other thing that really, I always talk about it in the context of climate is that one thing that I always complained to my mom about them not doing when I was a kid was not standing up enough to stop and prevent the war in the Balkans. And I have a 9-year-old right now, and I feel climate in a way is the same thing that is happening right now, that my 9-year-old son is going to ask me 10, 15, 20 years down the road, what did you do? What did you do right now to prevent this? Because that's going to be a reality that he's going to live into. So I'm just trying to avoid maybe the mistakes of my parents and try to do something when it actually matters, not when it's already late or as an after fact. Not to put any judgment on my mom, I really love her, but it is something that we always talk about and discuss in that context.
Yeah, absolutely. And I think with any of these, right, it's hard to be able to see in the moment what's happening, but this is what perspective gives us, is the ability to say, my parents may not have seen it, but I can see it, and there's something I can do about it. Gaurab, how about you?
Yeah, I think I start by thinking about my parents and kind of all they went through to be immigrants in the US. They had very little money growing up. My grandparents had even less. And trips to India when I was a kid, just kind of the shocking realization of how the vast majority of the world does not have, these basic needs addressed that allow for health and human rights. And I think I just grew up with this belief that I had this privilege and opportunity to have opportunity in the United States, not really because of anything so special about myself, but that conferred a responsibility to try to understand the world's needs and to be of service to people. And so that drew me to medicine and, particularly in global health work. And then in 2018 was my big climate awakening. I think for a lot of people, joined me in that moment, and kind of that IPCC report of 2018 being a truly formative moment. It was like a catalytic wake up for me, and felt just a lot of overwhelm and despair to just clear-eyed be able to see the science. I felt like I couldn't see the science before, although it was all around me and the work I was doing. And then suddenly I could see it everywhere. And so, what my reaction to that was very palpably was, we got to bring people together more and more and more. And so one of the most, immediate things I did was we just started, this was right before COVID, but we would have people come over, and in our basement, we'd have like this big group of people, coming together and talking about work that they could do to support climate solutions. And a bunch of people actually really developed some concrete programming. They connected with organizations, but that really taught me the importance of people coming together with shared purpose and using their emotions of concern for their children, for people's health, to make positive change.
Yeah, and this is a nice sort of segue into, and Pedja, you started talking about the Climate Health Organizing Fellowship that you and Gaurab have put together. Can you tell our listeners a little bit about that fellowship, what it offers, and what you've seen come out of that fellowship in terms of projects, or what capacity has been built as a result?
I think it starts from a place of our sense was that a lot of people felt lonely and isolated and overwhelmed, that they're working really hard in their clinical work and couldn't get the rungs to grab onto to build community and have a sense of how to take one step in front of the other on anything of any scale. And I really believe in kind of rich learning spaces where we can really have some space to think about how we move forward. So we went around to organizations like the Medical Society Consortium and a variety of others and said, hey, we really think these principles based on storytelling, based on building relationships, based on creating leadership teams and then taking action in your community, actually could not only build knowledge and skills, but also really create self-efficacy, sense of purpose, sense of inspiration, kind of prove to ourselves that we could do something and not just feel this despair in our homes, in our clinics, and not know what to do. And so it's very experiential, is very active with Pedja's brilliance, really leading a lot of the pedagogy on how to kind of structure your craft of community organizing and skill sets. We made those workshops at the heart of the fellowship, and these projects really the outcome. And, we've now had 4 years of the fellowship. We've had 30 groups every year. So people would apply as groups of 3. So we've had, a lot of people come through our program, total of Pedja, 160 fellows. Yeah. And it's been really great to see how these projects have unfolded.
And in a way, we filled in that gap was this connection between what we know and what and how we should do things. And not to be prescriptive in any way, because community organizing, as we teach it, is not prescriptive. It's actually deeply relational, and start with the question, who are my people? Not even what is the issue, but who are my people? How we can build a relationship among them, and then together start seeing what possible strategies and what actions we can take in order to change our own reality. We have to give credit to our friend and colleague, Professor Marshall Gans, is at the Kennedy School, who is the actual author of the framework of community organizing that comes from civil rights movement and the work with the Chicano movement in California that he did for over 30 years, but was amazing enough to give us the wisdom and give us the skills to train other people. But the other thing I want to say about the fellowship is from the get-go, we knew that it's a long haul game, that it's not like a one-off training, because there's no such thing as acquiring capacity to do big things with like a half an hour training. It's a year-long fellowship. It's a huge commitment from the people, but it is something that we knew is required to be able to build these connections and relationships in such a way that they become meaningful. And to run 4 cohorts that we did over the course of almost 5 years, it's been a true blessing, because you can see how some things or some groups and teams that we started with are not peaking maybe in the year that they're part of the fellowship, but 2 or 3 years later, all of a sudden there's an explosion in Wisconsin of kind of like climate health activists, or there's an amazing work that is happening in Pittsburgh or in other places. And it really shows and demonstrates that this is not a short-term thing. It cannot be. It's not dependent on any policy or administration or anything. It's really, really a commitment to each other, ourselves, and it's a long-haul thing. So.
A lot of the words you were saying, frankly, have been making me a little emotional because of what we as a country are going through right now. You use the word, Pedja, our people, find your people. I'm just curious for each of you, what does that mean right now in a country that seems so politically divided, where it just seems really tough to have common dialogue on the things that we all share? I would just love your thoughts and reflections on kind of this, what feels like a really perilous moment that we're in right now.
I truly believe if we can make the space to see each other's humanity and storytell in a way where we can explain what we care about and why, I believe we're wired to feel connection with one another if we give ourselves the space for that. So what I just want to highlight is, in the practice of community organizing really starts in seeing one another's humanity. The storytelling element is just so crucial, of putting away your phones and devices and not feeding into so much of the toxicity we see with some of these algorithms online, and building community together. That is really hard work. To do that with one another as health professionals, to go into your community and build relationships. And there's hard work to do in that foundational relationship work, but it's unavoidable, and I think at the heart of what we need to do.
Yeah, I couldn't agree more with what Gaurab is saying, because seeing violence emerge is for me always a signal that we need to fight for connection with each other. That is actually the real fight. And what we were trying to do is allow people to get to that level of values and human experiences. And usually you do that through stories. So then you can start building the connection. And as much as we want to separate and divide because it feels easy, in order for us to actually live interdependently and together and save this planet that we have, only one that we have, we need everybody to that sense.
And this starts to get into, there were barriers in the past. We will be facing new evolving barriers into the future. What do you see as the barriers for participation for health professionals to infuse their practice with organizing? And what have you seen work to help overcome those barriers?
Immediately what comes to mind is overthinking. And the reason why I'm saying that is sometimes the climate space feels really overwhelming because of the magnitude of a problem and what we are trying to deal with. And the solutions that people see for engagement feels distant. Ahead of us is the COP meetings and stuff like that. Feels like too big to engage for someone who's working in a clinic or in a hospital. But if you turn that around and say well, let me look around me and let me not overthink what it means to be active and engage in this, you will find opportunities around you. And that's what our fellows mostly did, both pushing and inviting their hospitals to change the way they operate, to change the policies within their professional societies and putting climate on the top of the agenda of the professional societies, or working directly with communities to provide solar solutions on the rooftops. It's really the question, how do I turn again this question around, what is accessible to my people, so I can not overthink it, not kind of think about everything and every solution, but really get engaged at that local level with other people. And from there, contribute to the big picture policy change, because we need that as well, but without an illusion that there's something distant that we cannot influence in any way.
I think we can't disconnect this work from the experience of being in the healthcare system itself. And as we know, there's just massive levels of burnout, that people are working through really dysfunctional systems, trying to take care of their patients. And so, look, I think we've made some progress in some corners, and we've got a long way to go. That I do believe that health professionals being health ambassadors in society is important, that we show up to transportation meetings and grid meetings and energy efficiency for homes. This is actually really at the heart of making sure people are healthy. We need leaders. The consortium has made so many of them out there in the world, working with community groups, engaging with policymakers. And there's a vision here where you could have space to do that. And there's some, these medical directors of sustainability that are showing up in hospitals, roles like yours, Lisa, being leaders of climate health organizations. Health professionals want to be leaders, and they have ideas. They need a little space to think and to synthesize what they're seeing in clinic and operationalize it in forms of leadership. And you just need some space, to think and build. And we've got to give people space. Otherwise, we're just going to be waiting for people to get sick and come to our clinics, and we want to get in front of that.
What are some practical ways to give people space? I mean, there's this fellowship, obviously, but if a person doesn't have time for a fellowship, what are some other ways to do that?
Yeah, get together with others. That's always and ask that question, who are my people? Not what is the problem, but who are my people that I can potentially work with? Because as Gaurab was pointing out, the burnout question, I think that's a big among health professionals. Yet somehow we haven't seen it the moment that people start working together, relating to each other. It's so interesting. We'll have fellows who are doing full-time work, and they would say literally, even in paper that we published, that the fact that they're in a relationship with other people without constraints of a broken system that is forcing them to do something, but actually they are imagining and creating something, is an antidote to that.
Yeah.
And it's amazing to see. So I would say, like, go there, despite the fact that you might feel like, oh, I don't have time. Like, that is worth of an effort.
One thing I would add, I mean, it's always hard to create some boundaries. So you have maybe a day a week where you can work on other projects. That's the negotiation that many people are trying to do when they want to have other roles. One thing I'll just highlight is I think what we have been struck by, which is kind of true in my own life when I started doing this kind of work, is that we expect we're going to be really good at it right away and we're going to have success right away. And we're kind of trained to, for good reason, to be like, you've got to succeed in every patient interaction, right? Community organizing is a really different thing. It's very messy and it doesn't work often. And that's not a sign that you're not good at it or you failed. It's part of the process. Wins and losses are actually not that clear, in the process of not securing a policy win. You build relationships, you learn about what's really needed. It's a much messier process. And I think you really have to lean into that, embrace it, and realize that the journey is long.
Yeah, there was a colleague of mine said this, and it's always stuck with me. She said, if you win every battle you're fighting, you're not choosing hard enough battles.
Yeah, totally.
And I love that because it's right. Like the bigger the thing that you're dreaming of, the larger the structural change you're working for, you're going to fail, and you should, because these large structural changes should take a lot of organizing, a lot of conversations, and probably some compromise along the way to get there. So that's at least what keeps me going. Well, last question for both of you. What is giving you hope right now? I will tell you, this conversation has certainly lifted me up off the ground.
I think, again, starting with kind of my family background, I'm anchored in this understanding that, like, there's been suffering among human society forever, and people show up with courage, people show up with love, truly believe that the potency of love, taking care of each other, is something that is a current through society that shows up in ways in which we can't realize to make transformative change. And look, I think, the world is bigger than the United States also. And there is some pretty extraordinary gains. Read Bill McKibben's writings on what's happening on solar right now. We are in the middle of an energy transformation. There's no question. All of us who care about our climate and care about our children know that we are so far from going fast as we need to. But there's been decades of people whose shoulders we stand on, who got us into the position that we can have all the solutions we need at hand. And that's the era we're in. We have the solutions we need. And it's a matter of moving those forward with urgency and not letting politics get in the way.
Yeah, I'm just, like, I always refer to myself as a, intellectual pessimist and action optimist. So it's, when it comes to action, you need to do something, despite the fact that intellectually the world might look like a really dark place. But the last year it was published, Ayanna Elizabeth Johnson, like the book "What If We Get It Right," and I remember reading it and really, really feeling the sense of hope that, as Gaurab was pointing out, like, the solutions are out there. There is a possibility for us to get it right. And that's where the hope usually lives. It's not in the certainty, like, that's arrogant, basically, to say, like, we know the future. Nobody knows the future. But in that possibility, that space of possibility, that's, for me, is really hopeful. And that the whole thing that looks like, oh, we're dismantling the world as we know it, could be also the place of the birth of the different way of doing things together. So that, for me, that's kind of like, trying to keep that space alive in my heart and my daily practice is really critical.
Yeah, those are both beautiful sentiments to end on. Thank you both so much for your work, for your time, for your expertise, and for your passion. The world needs more use. So thank you so much. That's it for this episode of Healthy Climate America. We hope you'll take what you learned and share it with colleagues and friends. Our work also wouldn't be possible without our members and donors. If you enjoyed listening, please go to ms2ch.org and click on Become a Member to join our community. Healthy Climate America is produced by Savannah Martincic. Our podcast consultant is Julie Hantman. Our podcast intern is Isaias Segui. Our music was composed by James Harp.